panel joins us now with their questions. Kyle, Danny, Samantha, and Jessica. And here to help us answer them is Fox News medical contributor Dr. Mark Siegel and family and emergency medicine Dr. Jeanette Neshwa. Thank you, doctors, both of you, for being here for this segment.
Thank you.
And once again, thank you to our guests for your what I have seen a preview of some pretty solid questions. Let's start with Kyle. What is your question?
Are the massive public cancellations really necessary? Why haven't we gone to these extremes during past flu outbreaks?
Dr. Siegel, you want to take that one?
Yeah, the answer to that is that we're trying to figure out how to control the viral spread here. And the more we do to decrease the amount in workplaces and in large areas and where people are coming together, the less virus is going to be there to affect people that are very elderly. Now, I'll give you an example that you're not going to believe. I know for a fact that the concert series that they were having in Massachusetts recently led to an outbreak among young people that actually has led to some hospitalization. So the less public gatherings we have right now, the better. It's a new virus. We don't have immunity to it. We don't have a vaccine to it. We want to decrease the amount of spread.
Danny, we're going to take your question now for Dr. Neshwa.
Sure. What is a long-term plan to avoid reinfection once America has everything under control?
Great question.
Very good question, Danny. And hopefully the goal is that we have what's called a herd immunity, because we're going to have thousands and thousands of people affected from this virus, expected, because it's such a highly infectious and contagious virus. And so hopefully we will develop an immunity, but we don't know how long that immunity will last. But there are things we can do to protect ourselves, and that is continue safety measures, continue disinfection, continue hand washing, continue, social distancing if there ever is another outbreak, hopefully not. And then hopefully in the future we will have testing available so that we will know what preventative measures to take in the future if we encounter this type of a disease again.
Great answer. Samantha, you have a question that'll go to Dr. Siegel.
Yes. Will this virus hit its peak like the flu virus does? And if so, what would be the timeline on that?
Well, that's a great question, too, and that's something we're studying right now. We're hoping that it follows the pathway that the flu does. The flu is seasonal, and the flu will be ebbing somewhere around April. We're hoping that this is true here, that humid, hot weather with a lot of ultraviolet light where people aren't as close together, that we're going to see a seasonal decrease, and that'll give us time to try to figure out what to do next, to rush a vaccine, to really study this further.
Jessica?
Great.
Good morning.
Good morning.
My question is, while a lot of people are unaware about where to go for testing, should people be going to the emergency room? Should they be going to urgent care? Is this something that needs to be called in ahead?
Very good question, and thank you for asking, because we don't want to overburden the emergency rooms, which are used for true emergencies, heart attacks, strokes, that sort of thing. It depends on your symptoms. If you have maybe just some mild sniffle, a little cold, a little congestion, don't go to the emergency room. If you're unsure what to do and you have mild symptoms, you can call your doctor, and you can also use another great option is telemedicine, where you can, do, like, for example, Skype or FaceTime from the privacy and the comfort of your own home, and you won't expose yourself to infection if you go to the office or the emergency room, and you won't pick up something from someone else. So that's also an option for you. But depending on your symptoms will determine the next step, if you need to be seen, if you need to go, for example, into the office or the urgent care, if you need testing. Most people, if you'll need testing, for example, if you have high fevers, you're short of breath and coughing and you can't breathe, then likely you may need to be tested. And that's something, if you can possibly call ahead to talk to your doctor or call the urgent care ahead, then that's a good idea. Of course, if you ever have really significant chest pain and you cannot breathe, then you would end up having to probably go to the emergency room. But most people, majority of people have mild symptoms, and most people will recover with no medical intervention, which is very reassuring.
Our last question will go to Kyle, and you had a great workplace question for Dr. Siegel.
Well, how do we assure safety in the small workplace situation? Should we be sending our staff home to work remotely, or that's the question, basically.
Kyle, that's currently under examination by every major company across the country, and the answer is we're looking to do more remote work. What can be done remotely? How do you affect social distancing in the workplace? And it especially becomes a problem if there is a case in the building or in the company that you're talking about. That changes everything, and that makes us more aggressive. But we are definitely looking at how much can be done remotely. That's a very good way to decrease the spread of virus. And in the workplace, you got to actually disinfect your keyboard, disinfect your iPhone, use Clorox wipes around you, wash your hands vigorously, including your fingers, and keep well hydrated.
Well, thank you to all the guests for the fantastic questions, and to both doctors, Dr. Siegel, Dr. Neshwa. Thank you as always for being here. Really amazing. We're going